Island Prostate Centre, we're in Victoria. We're connected with a group of urologists. We're in the same building. They refer everyone with a new diagnosis to me to discuss treatment options. And that's a big part of my job, is discussing, you know, where are you in your diagnosis, whether it's a new diagnosis or a recurrence, and what treatment options are available to you. So I'm available in person, yes, but also by phone and by email. So yes, I discuss treatment options with fellows and their partners, other family members, just so that everyone knows what is available to them. Because I think a lot of the time when you're diagnosed, you get to see your urologist first and foremost. And they might tell you, yeah, surgery is a good option. And you might miss out on radiation or other therapies that you might want to consider. So that's a lot of what we discuss in office. I talk a lot about side effects and, you know, when would side effects start? What side effects might those be? And how do you manage it? Because that's the big part, is how to manage any side effects that might happen. So my background is in systemic therapy or chemotherapy. I've been a chemo nurse for quite some time. So side effect management is kind of near and dear to my heart, because I think we all deserve to live a good quality of life and not let medications kick our butts into, you know, not having quality of life. I have done some work with the team in Vancouver around sexual rehabilitation, and we know that that's a key part of prostate cancer, and especially the treatments with prostate cancer. So, and that's one of the potential side effects with any prostate treatment. So I'm happy to discuss any sexual rehabilitation concerns in my office, over the phone, by email, and we'll talk about some resources as well to look at that. Thank you. And androgen deprivation therapy. Does anybody have any experience with that in the room? With ADT or the hormone therapy? A few of you? Yeah. So
yes, I'm on, I've had radiation, and I am on
Zoladex?
Hormone blocker.
Hormone blocker.
Yeah. Do you remember what kind?
Oh,
Androgen.
No, X.
No, I can't. Once every 3 months.
Once. I bet that's called Zoladex.
Yes, that's
Yeah, it comes in a yellow box.
That's right.
Yeah. You know what one of the side effects of that one is? Memory loss too. It's hard to remember
And
little.
also this.
Yeah. So a lot of we do a lot of counseling in office around managing those side effects and what you can do to minimize the effects of that Zoladex. So
Memory loss.
memory loss. You know, when you're struggling to remember the name of your medication?
Oh, yeah.
Yeah, that could be a side effect. Yeah, we'll talk about that in a little minute.
Okay.
And another big one, and this one is also near and dear to my heart, is navigation and advocation. So the healthcare system's complicated, and I work in it. I know the lingo, but it's still complicated. Never mind if you have had no experience working in the healthcare system. You don't understand the language. You don't know, you know, how do I go get my prostate checked? How do I know about certain resources that are available to me? And I think one, you know, having BC Cancer Agency just down the island, it's a huge resource, but a lot of people don't even make it that far. So, or they enter into BC Cancer and they get lost because it's a confusing, complicated system. So that's what I like to help people with as well, is just how do you navigate the healthcare system? Because that can be really confusing. In Victoria, we have our monthly peer support meetings, and similar to this, you know, it's a group of people. We often have a presentation for the first hour, and all of those presentations are video recorded, and we have them available on our website, and I think Court has shared that with your group. You're more than welcome to come down. It's usually between 25 and we've had up to 90 folks participate, so it depends on the speaker, but it's a big group. Support groups aren't for everyone, but it's a really good opportunity to hear about other people's experiences and just connect with other community members.
Are they still first Thursdays?
First Thursday of the month, yeah. They start at 7 p.m. So it is a late evening, And I could understand why, when the weather's bad, we don't get as many people out, but it's a really good resource. But you can also watch the video online and see what the topic is about. And I think too, we all have experience with our doctors and our specialists, and they're telling us, well, this is the information you need to know. But I think the real professionals are people like yourselves, those who have gone through treatment for prostate cancer, or even no treatment, just knowing, dealing with the disease itself. So I think there's huge value in that. You've got a ton of professionals in the room. In Victoria, we've also got a cancer recovery exercise program, and that's probably our most popular program through Island Prostate Centre. It's twice a week, and there's 3 different groups that happen twice a week. And these guys work out together, and their partners as well. And it's much like the support group, but it's doing exercise. So I don't know if there's anything like that up here. But it's, when Court's saying, well, form your own groups, maybe that could be something of interest to go and, grab a workout buddy or a walking buddy and get moving. Because that, we know, and especially with androgen deprivation therapy or hormone therapy, we know that exercise can be one of the best ways to not only prevent recurrence, but just make yourself feel better. So exercise is key in my perspective. We have some counseling resources available as well. And this is also something that you could take part in if you're needing to speak with counseling about, just coping with prostate cancer diagnosis or treatment. Or maybe you have some financial concerns that are really affecting your quality of life. Or maybe you're just trying to figure out, how do I tell my family this is my situation? We've got some counselors at BC Cancer who are more than happy to have a phone consultation, or if you're in Victoria, you could connect and actually have a face-to-face. And any of these, if you do have the intent to come down and you want to access any of these, just let myself know, and I can make a direct referral for you. And any other community supports that we have. I like to connect people, and that's part of that navigation role. So that's kind of what we do in office. This page I handed out to everyone. This is our prostate cancer supportive care program. This is a program that was developed at the Vancouver Centre, the Vancouver Prostate Centre. And it was developed by some urologists a couple years ago, and they're really good at the surgery. They're really good at the diagnosis, but maybe they're not so good at the aftercare. And that's a huge part of prostate cancer, right? So they developed this group of information sessions. They call them modules. There are 6 of them, and they basically are information sessions to lead a fella and his partner through this whole journey, and give them the education they need, the information, and the support. So these are all available on a website. So when I say there are resources available to you online, this is what I'm talking about. The website's right down here at the bottom, pcscprogram.ca. And you can go on there and you can have a look at any one of these different modules, and we'll talk about each one in a second. They each have kind of a little bit of information at the beginning about what are we talking about when we're talking about pelvic floor physiotherapy. So they give you a little blurb, and then there's a video. The video is about an hour and a half, and it's delivered by a professional. So a physician, a nurse, a pelvic floor physiotherapist, an exercise physiologist. They're really, really good videos. They will give you a ton of information about a ton of different things that could support your health. So if you're in the decision-making process, there is one, the module number 1, it's a urologist and a radiation oncologist who are presenting about treatment decisions. So you get a ton of information there. Kind of the same sort of conversation I have in office about different symptoms, different reasons you would choose a treatment over another. The second one is managing the impact of prostate cancer on sexual health. And that's a really key one. And it's one that might be interesting before treatment or after treatment. And the beauty of this delivery, this online delivery, is that you can watch them in your own home. You don't have to attend a group session. You can watch this video over and over and get so many different things from it. So this sexual rehabilitation piece, it's a really interesting one. It's a nurse. Her name's Christine. She's from Vancouver. She's basically built the sexual rehabilitation information there. And she talks about, what's affected with treatment, what medications, or what are the different tools that could be used to regain sexual function. So it's a really interesting one. I've trained with her in Vancouver. So if you watch that at home and you have questions after, just give me a call and we can talk about any of those things. Because it's one of those things that I don't think was discussed often within men's health, especially within prostate cancer, until the last couple of years. Now that we're talking about it, we're realizing there's a lot of room for improvement, and there's a lot of intervention that we can look at early on to save one's sex life. So have a look. If you have questions, call me or email me. Lifestyle management is the pairing of diet and exercise. It's another really good resource, so have a look at that. There's a video for you. It's all about ADT, androgen deprivation therapy, so that's another one to have a look at. And it's interesting for those who might have to start ADT. It would be really wise to watch it before starting on that medication, but it's also really good to watch while you're on ADT. So it's a really great resource. Pelvic floor physiotherapy, and this is something similar to the sexual rehabilitation. We know that if we start pelvic floor physiotherapy early on, the risk of incontinence later on is less. So it's kind of that whole idea to strengthen your body while your body is healthy, so that later on you've still got healthy muscles and a healthy body to work with. So pelvic floor physiotherapy is all about maintaining bladder control. And that's another one that at one point maybe it wasn't discussed so often within men's health, but we're finding there's, again, lots of room for improvement there. And then counseling services. That's the final module in this supportive care program. Here in Victoria, we do have an advanced disease management class, and that one is actually on hold just for now. We don't have a program coordinator, so that one, hopefully in the next few months, it will be up and running again. So for any of you who might have had surgery and or radiation and are now, in the midst of a reoccurrence, or are already, you have had a reoccurrence and you're trying to figure out, well, what should I expect next? That would be a really good one to connect with. It's led by a medical oncologist, and she discusses basically all of the new medications that are coming down the tubes and when would we start one. So there's two different streams. One is for people who are on hormone therapy, and one is for people who have been on hormone therapy and their bodies are now resistant to it. So two different sessions that one could participate in, both really, really informative. So they're all available to you. I would, if you're curious about any of these, watch them at home. If you have questions about them, give me a call and we can have a conversation around the content. You've discussed a few important points there, and I think the big one is this idea that sex should be all about the physical. And I think, we've become aware that it's more about the intimacy and sharing that intimate relationship. And I think that will often start with having conversations around what is important to a couple in their sexual function.
Well, usually in the support groups, the women don't come in with cords. there are very few of us around.
Yeah.
That ever come.
It's like that in Victoria too.
Yeah.
We have 80 fellas and 5 women.
That's right.
Yeah.
And guys, we do have an opinion.
Yep.
Even though there are few of us.
Yeah. Well, and that's prostate cancer. It is a couple's disease most often.
Absolutely.
Yeah, it's not just for the men only. I mean, that's who's undergoing the physical changes perhaps, but it affects a lot within a couple. Yeah. Yeah, you might find the sexual rehabilitation session interesting. Christine, that's almost the bulk of her presentation is actually about connecting on a more intimate level as opposed to just the physical. She definitely does discuss all the different medications and injections and pumps and everything that can be used to support sexual function. But that's not the take-home message. It's more around the intimacy, which is so important, which all starts with having a conversation and communication. So, thanks for bringing that up. Yeah. Yes.
I'd like to bring up, I don't know how many gentlemen here have had radiation, but I finished radiation about 6 weeks ago now.
Oh wow.
And I've suffered from permanent wanting to sleep and no energy whatsoever.
Yeah.
Is that common, and how long will that last?
That's another very good question, and it is quite common.
Yeah.
Most fellows, from my experience, most fellows go through radiation. And just to back up a little bit, was this external beam radiation paired with brachytherapy, or was it
No brachytherapy.
no
it wasn't
brachytherapy? So it was external beam
It was
radiation.
20 shots. Yeah.
So you have a daily appointment at
Right.
BC Cancer. You
right.
have to show up and be accountable every day.
That's
It's
right.
like a full-time job,
That's
right?
Fill up your bladder every day,
And then hold it.
and then
Yeah. Yeah, no fun.
no fun. No.
But most fellas, they go through radiation, they feel okay. They feel like, okay, this isn't that big of a deal. But it's usually after the fact.
After.
Yeah, yeah. After, most men feel like, wow, I've been hit by a truck.
Yeah.
And paired that with the side effects of ADT, the fatigue, I think, is most likely from the hormone therapy that you're getting. And then you stack on the radiation therapy, and absolutely, that's a very common feeling, to be tired. And it could last 6 months, it could last about a year.
Oh my God.
So I have a question for you. How long have you been on ADT?
3 months.
About
3 times before the radiation.
Okay.
about
9
3
months.
months.
About 9 months?
9
Yeah.
months.
And will you continue to be on
Yes.
ADT?
Yes.
So what I've heard from, I don't know if any of you have worked with Dr. Goulart. She's one of the radiation oncologists at BC Cancer. Yeah. She came to one of my presentations one day, and I had a similar fellow ask about how long will this last? So she suggested that as long as one is on the hormone therapy, so if you're on it for a year, you will have another year of feeling those side effects. Yeah. So the ADT is a tough one. It really is. Yeah. Something I've learned through working with people who are on heavy-duty chemotherapies, who are just wiped right out all the time.
All the time.
All the time. And there's other things that they're dealing with. But getting a daily dose of exercise can, and this doesn't mean weightlifting and, doing push-ups and sit-ups. Getting out for a walk, getting the heart rate up a little bit, and just getting the lungs open and breathing, that can really help with the side effects.
That was the next question. You don't feel like doing anything.
I know.
So how hard do you push yourself?
Yeah, good question. The recommendations, and again, you will see some of the recommendations in that module about the ADT. They will tell you to get at least 5 days a week, get half an hour of vigorous exercise. Vigorous exercise is when you're working hard enough that it's hard to carry on a conversation. So say you guys go out for a walk and you're puffing and it's hard to have a conversation, you're doing it right. Yeah, yeah. You might have to have a nap after that.
Definitely.
But I would be really curious to see how that would help you
All right.
over the long term.
And it's
Yes,
down to 15 minutes.
exactly. And that's a really good point. You don't need to start guns a-blazing, okay,
No.
let's go. You can start with 5 minutes, 10 minutes, go around the block. Yeah, slowly increase your capacity. Yeah, yeah.
And the next question, and then I'm finished.
That's okay. The more questions, the better.
Okay, that's exercise. How about diet? What should I not be drinking or eating or
Yeah.
whatever?
Have you seen the new Canadian Food Guide?
No.
Okay, have a look at that. The new Canadian Food Guide is really what the dietitians at BC Cancer recommend for fellas with prostate cancer. So lots of fruits and veggies, lots of grains, healthy grains, decreasing your red meat consumption, especially if it's barbecued or broiled. The burnt part of red meat is actually incredibly toxic for our bodies, and it can increase your risk of recurrence. So increasing your fish and chicken intake as opposed to eating red meats. Lycopenes. Has anyone heard of lycopenes?
How about coffee and things like that?
You know what? Coffee, I'm never going to tell anyone to stop drinking coffee. I think if you like coffee, drink it, but everything in moderation. Alcohol, coffee, anything like that.
Okay.
I think if you enjoy it, have it. Getting back to the lycopenes, I don't know exactly what a lycopene is, if it's a mineral or it's basically part of any red fruit or vegetable. So pomegranates, tomatoes, anything that's red have something called lycopenes, and lycopenes are really good for preventing recurrence and preventing prostate cancer initially. So you can put that on your list of things to research. The dietitian team at BC Cancer, they do recommend increasing your lycopene intake. Lycopene. Yeah.
Okay.
Yeah. But yes, fruits and veggies, whole grains, decreasing your animal fat intake is the recommendation, which includes milk, butters, yogurts, all that kind of stuff. Eating less of that and more natural foods, I guess. Summer's coming though, and it's ice cream season, so
No ice cream.
you're gonna do whatever you're gonna do. Ice cream in one hand and coffee in the other. Yes.
I live on my own, so I have to make all my own meals and shop for everything that I've got to do in that respect. And I'm just wondering if there's any type of diet that a person could use as a model, both the shopping list for one thing and also for what the items are that should be bought.
Yeah, that's a good question, and I'm not 100% sure on the answer to that. I'm sure there would be resources, some tools to use around developing shopping lists. But again, I think if you have a look at the Canadian Food Guide, it will tell you on a daily basis how much of each type of food you should be eating. So you might want to have a look at that and then come up with your own meal plans depending on what you like. They might say you should be eating a cup of rice every day. Well, maybe you don't like rice. Maybe you prefer quinoa or barley or something like that. So you could adapt it to your own needs. I'd be happy if you want to send me an email or if you want to give me a call, I could connect you with the dietitians at BC Cancer and you could have a phone consult with them. And they might have some really useful tools as far as meal planning.
I
Yeah.
don't know that I have cancer, I've got prostate cancer. I'm 90 years old and I came a while ago just to check up on this group because I didn't know that I would be expecting to get that type of thing at this late stage in my life. But
Yeah.
most people here seem to think I'm past it as regards getting anything in the way of prostate cancer which is going to affect my life.
Nah.
I might die with it, but there's nothing to say that I've got it at the moment.
Gotcha. Yeah.
So it's not just for prostate cancer that
Yeah.
I'm looking for the diet, it's for regular diet,
For
daily life.
general health, right? Yeah.
But
And
I'm sure that both things would fit together.
absolutely. And I think that's one thing around recommendations for prostate cancer is that they're also recommendations for general health and well-being, like the walking, like the diet. It's all about being a healthy person as long as you want to be. Yeah. But yes, if you want to send me a note, I'll get back to you probably next week and could connect you with the dietitians there. And that goes for any of you. If you want to connect with dietitians or exercise physiologists, counselors, just send me an email or phone the office and leave them your contact info, and I'll happily get back to you and we can connect you with whatever resources you need.
We have your email address.
You don't, but you know what? Maybe I'll write it down and pass it around.
Yeah.
The family physicians don't necessarily have specific knowledge around prostate cancer.
Mhm.
They know how to diagnose or how to refer you to a professional, but that's kind of
they
it.
can do a visual or all that
Absolutely.
stuff like that.
Yeah.
But after the fact, if you have symptoms or issues.
Yeah. So a lot of the fellows who are volunteers with Island Prostate Centre, they have actually I have a new patient package that I build for patients who are coming in for diagnosis or for conversation around diagnosis. And they have taken that exact folder and they've given it to their GP to say, here's a resource. This has helped me out immensely. And the reception from their GP is fantastic. These GPs want to know more. They want to know where they can refer. So I'm happy to send some up or get some to you.
So will your group, or maybe through referral to the cancer, BC Cancer Clinic, there's a way to kind of connect your family physician back to a particular topic or an issue through IPC?
Yeah, and you know what? I think it's just about awareness.
Yeah.
Making that GP aware that we do exist and that.
Because I don't think they do.
I don't think, even in Victoria, most GPs have no idea we're around.
Right.
Yeah, that's a big struggle for us is educating family doctors that, hey, there is this resource and we are well connected within the oncology world, but not necessarily the family practice world. It's amazing because anyone with a cancer diagnosis is at an increased risk of developing a clot, period. That's just the way it is. Having treatment for any kind of cancer also increases the risk.
It again.
Yeah. So as an oncology nurse, I know that. That's something I learned years ago, but unless you have that focused awareness around oncology or cardiology or whatever specialty, you might not jump onto that. You might not start assessing your legs for a DVT.
Right.
Yeah. GPs are generalists. And that's the tricky part. So I think that, you bring up a good point that as patients, it's really wise to educate your family doctor about what you're going through and what has come up for you and what you've learned along the way about prostate cancer or anything else that has been part of this process. Yeah, we are a resource and not just for patients and family members, but also for your family doctors. If you don't feel as though you've been heard or they're maybe brushing off symptoms, then absolutely let them know that, hey, there's this resource in Victoria and they'd be happy to discuss prostate health issues or have questions, So
Thank you.
yeah, welcome. Yes.
I've heard brachytherapy mentioned 3 times. I have no idea what it is.
Okay. So brachytherapy is a form of radiation therapy. And so it's the implantation of radioactive seeds into the prostate, basically to give radiation from the inside out. It's sometimes done all by itself. It is often done paired with external beam radiation. So traditionally, a man would go on hormone therapy for 3 to 6 months prior to any radiation at all. And hormone therapy shrinks the prostate and lowers the PSA. And because the prostate is that much smaller, it's easier to direct radiation at it. And when it's smaller, that means less collateral damage to all the tissues around, such as the rectum, the bladder, all of the tissues that are surrounding the prostate. Most men, similar to yourself, get about 4 to 6 weeks of external beam radiation. And then there's usually about a month break, and then brachytherapy would be delivered. And it's a day procedure. It's similar to a biopsy, how they go through the rectum to implant these seeds.
They're delightful.
Very delightful, yeah. The nice thing about...
You're out for that one.
Exactly. With brachytherapy, is it a general anesthetic? Or
Yeah.
sometimes...
I think it depends on your situation.
Yeah.
Your age. And
Sometimes a local anesthetic and sedation, so that you're given all the goofy juice and you don't really remember what happened. Yeah. So it's something, it's fairly new, I think, within the last 15-ish years, and it's hugely effective. Yeah.
Maybe one other thing, just because I had brachy,
Yep.
is I didn't have any hormone therapy just based on early detection and probably, I don't know, maybe some other factors, but there was no introduction of hormone therapy with mine
Yeah.
at all. So,
And
not so far.
And one of the radiation oncologists that we work with in Victoria, Dr. Alexander, who's given a lot of our talks, he said because radiation therapy is so advanced now, they're often not doing the ADT, the hormone therapy, which is really nice to hear because it kicks your butt, doesn't it?
Mhm.
Yeah, it really does. So if we can veer away from that, it's even better. Yeah. So they're really refining their techniques. And another note with the brachytherapy, there's 2 different kinds. There's the traditional brachytherapy where they implant those seeds and they're there forever. So every time you go through the metal detector at an airport, it's going to beep. Yeah, so you're going to get pulled over. There's another kind, and it's newer, it's called HDR, high dose radiation, where they implant some seeds for a short while and then they take them out. So 2 different kinds now to explore. Yes?
Well, I presume mine will be in permanently. They're not radioactive.
Did you have brachytherapy?
No.
No. So you don't have any beads in there?
I did, I had them implanted.
Oh, you had the fiducial markers.
Okay.
Yeah.
Yeah.
So those markers are basically so that every time they put you into the radiation machine, you're in the exact right spot.
Right.
Yeah. They used to do tattoos.
Yeah.
Yeah.
Right. So, will the same thing happen when I go through airport?
Did you get a little card to carry with you?
No.
No. Then you likely won't. Yeah. I think it's because typically with brachytherapy, they're putting about 100 seeds into that little prostate, which is a lot. So that whole prostate is full of radiation. Yeah. Yeah. Any other questions?
So now you know.
Yeah.
Would the markers be titanium as well?
I'm not sure. I don't.
Seeds are titanium.
Yeah. I'm not sure what the fiducial markers are made of. Yeah. Because they do have nurses who all they do is take phone calls every day. And if you say, hey, this is my story, I had brachytherapy X amount of months ago, I don't know what to do with this, and maybe you've seen your family doctor and they don't know what to do, then it's up to your the radiation group to help you out with that.
I went to the urologist. And
Okay.
He didn't seem to know anything that you told me.
Yeah, because they don't know radiation.
Yeah, they don't do oncology.
Yeah. So and because this is a result of the radiation therapy, it's up to the radiation oncologist to help you out. That's the way it goes.
I have received calls from Sabish
Oh, okay,
up until 6 months or so ago.
okay,
And the next time I get a call, it'll be from somebody else down there.
okay,
And I forget her name.
okay.
Wouldn't you be off their program too, based on your PSA? Like, wouldn't you have been sort of released from any
Sabish has released me, but he put me on, not the program.
Oh, really?
You're probably receiving a phone call from Emily Priestley. She's the nurse practitioner.
Oh,
Have you met her?
Yeah.
Yeah, she's lovely.
yeah.
Yeah. Have you talked to her about your issues, your digestive and urinary issues?
No.
Because she would be great at helping you with those
I've
ones.
got her card.
Okay.
Yeah.
Give her a call.
Okay.
Yeah.
I was
Yeah.
under the impression that it was a female oncologist. that
Oh,
I
okay.
could call from.
Okay.
Is there a female oncologist in Victoria?
Yeah, there's lots of them.
Yes, Dr.
Dr. Goulart is probably, she's the kind of the lead of the prostate group.
Yeah. That's
Yeah.
right.
So you could always phone the telephone nurse line, because if this is something that you're experiencing now, why not start investigating it now? And they could at least get the wheels in motion to maybe get you in sooner, or have a telehealth appointment. Because that's something I hope you're all aware of as well. You know, if the weather's not cooperating up here and you've got an appointment in a week down in Victoria, and say it's just snowed, you can have a telehealth appointment. You don't have to drive all the way down there. If
My
you,
last appointment was a telehealth.
Good.
Of the clinic in Parksville.
excellent. And how was that? How was that experience?
It was fine.
It was good?
Yeah.
Yeah. You're just not getting in the
I felt
hands-on.
like it was sort of missing something, but that's
Yeah.
probably just
Yeah.
me.
Yeah. But it is helpful, and it saves you a whole day trip down to the city.
For 15 minutes.
Does everybody know
Exactly.
what that is?
Good question. And does everybody know what that is? It's basically, a telehealth appointment is not a face-to-face with a doctor. You're at a medical clinic of some sort in front of a computer screen, and the staff there will get everything set up. You sit down, and then your doctor will be on a computer on the other in Victoria, and you can have a consultation via kind of like Skype or FaceTime almost.
Oh, we're a medical clinic. Where do we go here?
I don't know the
The
answer to
medical
that.
center here at Oceanside Health Center,
Parksville?
Ben Parksville.
You've done it?
There may be others, I'm aware of that one. Any
Yeah.
others, Brian, you're,
No, I would think that's the only one.
Yeah.
You know, unless there's a specialized clinic that
So-
sets
so you-
something up.
You have to set up an appointment for this?
yes.
So when you get a call from BC Cancer and they say your next appointment will be this date, you can ask them at that point, could we set up a telehealth? And they'll set it up on their end. So you don't need to set it up. Victoria should be setting it up.
Okay.
Because they'll know all the locations where they can do telehealth,
Okay.
and they'll find the closest one for you, and then they'll let you know it's at this place at this time.
Okay.
Yeah, yeah.
You can't do it on a home computer?
Not yet. I know that there was some talk about doing Skype for business to conduct these telehealths, but I think just because of privacy issues, they're not there yet. Yeah, unfortunately. Someday they will be. Yeah. Yes.
Question at the end, but my PSA is about 2.1, been like that for years, but I've had a large prostate for 20 years probably.
Uh-huh.
And anyway, I just wondered why do you have to get up, pee so often at night, and during the day I'm normal?
I know.
What's the cost of that?
That's a really good question. So if everyone heard that, it's,
Opposite.
what's that?
I'll do the opposite.
You have to pee all day, but not at night?
Yeah, just dribble all day.
Yeah,
But I sleep through the night for somebody else.
yeah. And have you had treatment for prostate?
Oh, yeah.
You're not, your prostate doesn't have a hold of you. You're doing your own thing during the day. When people lay down at night, their fluids shift a little bit. And a lot of us during the day, we retain fluids in the legs. And at night when you go horizontal, some of that fluid moves back up in the body. And that's why sometimes we can start peeing during the night. Also, some things to think about are, stopping your fluid intake around 5 p.m. so that you're not drinking later in the evening, filling up your bladder. That's really the only rational reason I know of that why men would have to get up so many times throughout the night. And what I hear from a lot of men is that usually it's a fair amount, right? It's a full bladder most often. That's the only reason I know of why men would have to get up throughout the night, because that fluid is coming back into the core.
Could wear a tourniquet around my legs.
Yeah, you could. Or put on the compression stockings to go mow the grass. Yeah.
There's absolutely something to that. Sure.
Yeah. I wonder too if maybe when you're sleeping, your prostate is actually a little bit more relaxed, so it's allowing a lot more urine to pass. Similar, some medications allow the prostate to relax and open up the urethra a little bit so that urine is allowed to pass.
So how many valves do we have?
How many valves do we have? So we have one valve between the prostate and the bladder. It's kind of right between the two. So right where the bladder neck's coming down and the prostate sits right below it. The prostate's wrapped around the urethra. There's a valve right there, and it's right between the prostate and the bladder. And it's during surgery, that valve is actually removed with the prostate. Yeah, because it is part of the prostate tissue. So they don't want to leave prostate tissue behind because there could be cancer still in it. So that valve's gone. There is, however, another valve just below it. So that lowest valve remains. So the lower valve, it's, okay, I'll back up a little bit. The top valve is the one we never think about. We call it autonomic. So it keeps our bladder full until we say, okay, it's time to go to the washroom. We never think about that one. Unfortunately, that's the one that's removed with a prostatectomy. And that's also the one that's affected with radiation therapy. The valve that's below, it's one that we have to actually control. So when you're running in the house and you've got your hands full of groceries and you're thinking, oh my goodness, I have to go to the washroom, and you're holding it, that's the valve you're actually thinking about. That valve, it's the one that remains. It's the one that we can train to become really, really powerful. So when I was talking about pelvic floor physiotherapy, this second to last module, pelvic floor physiotherapy is basically learning how to control that bottom valve. A physiotherapist has special techniques to teach you how to do something called a Kegel. And a lot of women know Kegels because a lot of women experience incontinence after childbirth. So this is a similar, it's a Kegel as well, but it's a little bit different anatomy, but it does the same thing. It's teaching you how to control your bladder. And so even if there's some leakage during the day, introducing Kegels can be really effective. First off, for anyone facing a prostate cancer diagnosis, I wouldn't buy any medication on the internet. You want to speak with your doctor, preferably your urologist, because they have inside knowledge as to what has happened for you and your prostate. So that's my disclaimer. We know that testosterone can feed the progression of prostate cancer. While on active therapy, no, you do not want to be taking supplemental testosterone. I was at a dinner about 6 months ago with medical radiation oncologists, urologists, and some other specialties, and that question came up. What about supplemental testosterone? And the consensus around the table was that if a man if he has had treatment and had a stable PSA for 1 year, then yes, we could consider supplemental testosterone. If there's no if that PSA is staying nice and low. So we know that testosterone can really help with energy and with libido. And, you know, what testosterone can do for energy is significant. So that might be something to consider for anyone who is experiencing a real lack of energy. You know, as men age, the testosterone level does get lower and lower. And I'm a huge fan of letting nature do what it does. I think adding things in can create chaos in the body. Hormones control a lot more than we know. And I don't know if I would really adjust hormone levels too much, but it's a conversation you could have with your urologist. Yeah. Any other thoughts around testosterone levels? So you've had a double whammy.
Yes.
You've not only had to come off the testosterone,
Yes.
but you have been prescribed ADT, which blocks the production of any existing testosterone.
Yes.
Yeah. Oh, not easy. Not easy at all. No.
It's all right.
Well,
Still upright.
you're still smiling.
Still smiling.
Yep.
So in your opinion, I'd go back to this scenario where you're under the care of a family physician. Any type of post-treatment discussion on testosterone should be reviewed with your original oncologist? Or
Oncologist or urologist. I think those two people have the knowledge and awareness to have a conversation with you.
Right.
Yeah.
Okay.
GPs, unless this GP is really savvy around testosterone or prostate cancer in general, they just may not have the knowledge or the time to do the research.
Okay.
Yeah.
Thank you.
Yeah, I think anything, and that's, I guess, you know, a take-home message, any prostate-related issue, even though you have probably been discharged back to your family doctors, any prostate-related issue is probably best dealt with your urologist or oncologist. Yeah.
I want to go back to that P stuff.
The P stuff.
Is it possible that as we age, the bladder is not as flexible?
Absolutely.
And it can only fill half as much, and we feel we gotta go?
Yep.
And that is a problem through the night?
Yep, absolutely. The bladder is made of smooth muscle, and as we age, our muscle is not as elastic as it once was. So yes, it makes perfect sense that, maybe at one point we could hold a liter in there and keep going. Maybe now, because it's not so stretchy, we can only hold 250 mils. And then the stretch receptors turn on and they say, ooh, you gotta pee right now. Yeah. Yeah.
Anyway, no way to regenerate that.
No, well, in a sense there is. There's a lot of new therapy for bladder issues as well, and incontinence. They're now doing Botox for the bladder. There's a urologist in Victoria, Dr. Hogue. His specialty is kind of bladder control issues. And one of the new therapies that it works really well is Botox for the bladder. So it actually can prevent incontinence, and it can just allow for longer stretches between bathroom trips. So if that's anything you want to look into, again, send me a call or an email, and I could send you his information, or you could just look up Dr. Nathan Hogue. And he's great. He's also the guy who, for fellas who have had prostatectomy or radiation, he can discuss things like the sling, a sling to actually pull up the bladder, which creates a different sort of valving system, or it helps the valve to work that much more efficiently. He does artificial sphincters for the bladder as well, so you can actually control when you want to go to the washroom. So that's his specialty in Victoria. Yep, he's the urine guy.
So, Connie, just so I'm clear, because I keep thinking about the system.
Yes.
Do you get a referral to somebody like that through your oncologist or urologist, or can you contact them directly because they've got a private
Well,
clinic, or how does that work?
Yeah.
You can call him directly?
you could always call the office and see how that referral process
Okay.
goes. Typically, it's doctor to doctor
Yeah.
for referral. Yeah.
Yeah, usually, hey?
Yeah. But if you approached your family doctor and you said, hey, I just learned this. I learned about this Dr. Hogue in Victoria, and these are the things he does. I would like for you to refer me. Then
Okay.
your doctor could do just that. Yes.
Does old age spread mean that your internal organs collect more fat around them that in effect restrict the amount of flexibility in a thing like the bladder that doesn't allow it to expand or permit it to only hold a quarter of a cup rather than what it did before, or a half a cup or a full cup?
So just want to wrap my head around your question. So are you asking if organs retain fat
Yeah.
and cause pressure on the whole system?
Yeah.
I think if you are carrying a lot of adipose tissue or fat around the midline, then yes, it would be conceivable to think that there's probably fat around the organs too. Which, of course, if there's any extra tissue in the abdominal cavity, it's all going to push on each other. With age, as we discussed with that bladder, muscles become less stretchy, less flexible, and they just don't work as well as they did when we were 18 years old. So with time, things do become less elastic. Yeah, the heart, the lungs, every organ, really. Can you train your bladder?
Yeah, by doing that.
Yeah, that may be a not so good thing to do, because then you will train yourself to go every hour when maybe you want to go every 3 hours. I guess if you're going every 15 minutes, then that might be a good place to start. Yeah, I don't know the answer to that. I think we can be trained to do anything. Oh, nurses are famous for that too, for not going to the washroom all day.
That's right.
Yep. You know, we know that cancer goes to certain places. Different cancers travel to different places. With prostate cancer, the usual place it travels to first is the lymph nodes, and then it basically gets into the blood system, and it will set up camp in the bones. That's kind of the primary spot that it'll move. Sometimes the lung, sometimes the brain, but not very often. Typically it's the bone.
So the PSA goes up.
Yeah.
Let's say myself, I'm at 0.0001 or whatever, and all of a sudden it's 2. You will not be able to detect where it is?
Because it's still so low. So 0.008 is the lowest a PSA test can detect. That is the bottom of the barrel. So if it, and I've heard, I think it's 0.2 is when they start investigating. When they start doing bone scans, CTs, MRIs. That's just imagine the system, the body. It's one little molecule floating around in the body, right?
So it's a molecule, a PSA is a molecule, not a cell. So it's not a cell yet.
Well, it's something that's detectable by a test, okay? It's floating around in the body, and this test at one point detected none of it. Now it's detecting a little bit more of it, and now a little bit more of that. But that doesn't...
Multiple ones it detects? How does it detect? Is there multiple...
Well, okay, so imagine a tube. You've got a tube.
Yeah.
Most of the cells in that tube are red. Once in a while you see a yellow one. That yellow one is the PSA, right? At one point in that tube there's only one floating around. And then there's 5. And then there's 20. So it has to get up to a certain level before they can say, okay, we know at this level it has typically set up home and it's reproducing somewhere, like
somewhere, but still
the bone.
don't know where.
But they still don't know where because it's so small, no imaging will detect it.
What happens in lymph nodes and if it migrates to the bone? Does it metastasize? Does it actually it do the same kind of thing, at least in the lymph nodes?
Yeah.
That it does on a prostate?
Yes, so it's always still prostate cancer, even if it's moved to the lymph nodes or to the bone. And it's setting up a little home base, And there it's starting to reproduce and become more and more, it's getting more of a blood supply. It's bringing in more nutrients.
Well, the reason why I asked, because I was diagnosed because I had an MRI, and my numbers were still pretty low.
Yep.
That's the only reason I think about it. At some point in time, they might be able to locate it with an MRI or something.
Well, a PET scan now is kind of the gold standard for detecting prostate cancer. Has anyone heard of a PET scan in here? Yeah. So a PET scan, it's another form of imaging, like an MRI or a CT scan, and you are given a dye. You're basically injected with a dye, and this dye attaches itself to any PSA molecule floating around the body. And when they take the image, if they see an area, say in the scapula, in the shoulder blade, and this area is bright, it's a different color than the rest of the body, that means there is some cancer happening there, and it's prostate-specific cancer. It's not bone cancer, it's prostate cancer, because this molecule only attaches to prostate, to PSA. When they know you've hit that certain level where the disease is detectable, they will say, go for a PET scan. And that will give them an image of where that disease might be.
Okay, thank you.
Yes?
Isn't there going to be a new PET scan in Victoria?
Yeah, so they have the funds, they have the space for a PET scan, but we may not see it be a PSMA PET scan. So PSMA is the radioactive substance that they inject for men with prostate cancer. It's developed in Vancouver, and they're trying to figure out how to get it to Victoria. It has a 90-minute half-life, so they can use it only in a short window, and they're trying to see if BC Ferries will move it for them. So yes, the PET scanner is coming. It was supposed to be here last October. Still not here, but it is on its way. But I mean, truly, a trip to Vancouver to have this test the ferry's covered through a TAP form, and I hope you all know about that as well. If you ever have to go to Vancouver for any treatments, there is something called a TAP form, T-A-P. I don't know what TAP stands for.
Travel Assistance Program.
There you go. Travel Assistance Program. And that covers the cost of your vehicle, yourself, and a driver. So two of you can go over and come back for free to Vancouver. In case you ever...
You get those forms from your doctor, the referring doctor.
That's right. Yeah.
Is that similar to bone scan? Like when they do a bone scan
It's kind
prior to prostatectomy to detect if, like we were just saying about this other scan?
Yeah, it is similar because it is a whole body image. Yeah, but it's much more, it's only looking for prostate cancer. Yeah. At least the PSMA PET scan is looking just for prostate cancer. Yeah, there are PET scans for lymphoma, for all sorts of different diseases. There is a small percentage of men who the PSMA molecule will not attach to. So there is a small amount of men who might go for a PET scan and it's going to show nothing, but there actually is something happening. It's just that their body won't take up that PSMA PET. Well, they're using them for all men with prostate cancer. It still is classified as a clinical trial, as far as I'm aware. There's one in LA. There's one in Montreal as well, I believe, and they're not clinical trials. You can just, especially the one in LA,
Yeah, it's a private clinic.
Private clinic, you hand them $3,000 and they'll say, let's do it.
Do you have any experience of that, cannabis and fighting cancer?
We had Dr. Muhammad Ali come and speak with our support group, and actually I have to thank you guys for that, because last time I was here, Dr. Muhammad Ali you guys spoke quite highly of him and his wife, and they actually came to speak with our support group. He's a urologist from Port Alberni, and he is working with Health Canada to unroll the cannabis laws and everything. So he's actually a prescriber and an educator. He works with the group at UBC to educate people around the use of cannabis. So on our website there's a really good video that he has done to educate our group around cannabis. And yes, and my experience within chemotherapy, You know, 5 years ago, people would ask you out of the corner of their mouths, hey, do you know anything about marijuana? Cannabis, it's being used for symptom management, and it's really effective. So for appetite, for nausea, for anxiety, sleeplessness, pain's a big one. Pain's a really big one. It's a really effective tool if used for symptom management. There are no studies yet to show it is a cure for any cancer. I know there's tons of press around that, but there's no evidence to show that it's actually to be used as a primary therapy. Yeah. Yeah, there's a really great video.
Biggest users is our kind of group, apparently.
Apparently so. Yeah, well, it's out there, and it's in so many different forms, and it's readily available. Just like surfing the internet, though, be careful who you're getting it from. Be careful who is giving you this information. After meeting with Dr. Muhammad Ali, I thought I would never go anywhere now but Health Canada to get it. I've gone to some of these dispensaries in Victoria, and holy smokes, there's some hokey stuff happening in there. So I think I would go the route that he would recommend. And I think it all comes down to the CBD THC balance, because CBD, it's not the one that's going to get you high or stoned, but it's the one that offers the most symptom management. But it needs to be balanced with a certain amount of THC. So, and that's something that, you know, you'd want to discuss that with whoever is selling you the product, because they would know what sort of balance you would need for pain control or nausea management. They would know the right balance there. Yeah. I've heard a lot of good reports for helping people sleep. That's been a big one that I've heard of. So yeah, I used to have a lot of little old ladies ask me in the chemo room, hey, do you know where I would get some marijuana? And now people are just talking about it. It's out there, which is great because it's super effective. And we know that any medication you take, it's going to cause a ton of side effects. And you don't want more side effects. So why not just take something that helps you with that ailment? Case closed.
Where do we get that?
Well,
Street corner?
nope. Look at Health Canada, actually. Their website is not very good. It's really kind of a confusing website, but you know where I would start, honestly, is with Dr. Muhammad Ali. So I would just type in, use Google and all that, type in Dr. Muhammad Ali Cannabis, and he will pop up. He works with Health Canada, and he will do Skype assessments and see. He will ask you, why do you want to use this? What do you need it for? And he will make recommendations. He does come with a cost, though. It's not free with him, but it is a medical consultation, and I would guess that could be covered by Blue Cross or Sun Life, also written off as a health expense on taxes.
It's $90, the consultation is
Okay.
$90.
Okay.
For Dr. Muhammad Ali.
Is it? Yeah.
That's my understanding.
Yeah, I think that sounds about right to me. And then he does, you know, if it's something that you're interested in, he will follow up and direct you how to use it and all that business. Yeah, he's really great. And that's another take-home message too. As far as cannabis goes, you know, it should be taken orally or topically, or, you know, as a suppository if necessary. But smoking anything is toxic to the lungs, right? So if you can avoid that, do so. We provide the video from each speaker series here, so click on that. And this is going to take us to our library of videos from our support group. Dr. Muhammad Ali is on here. So there he is right there.
Yeah.
The shiny guy. Yeah, that's how you access all the videos for our support group. And there's tons of information on there. So if you're ever bored, it's a rainy day, you want to know more about your prostate, go have a look there. Pelvic Floor Rehab with Laura Warner, that's another fantastic one if you've got any urinary issues. She's our pelvic floor physiotherapist in Victoria. She's private, so if you have third-party insurance, you could have that covered with her. But she's She's the guru around Kegels. So this paper I gave you, this website right here, pcscprogram.ca, that's the home screen. This is what you'll see. So if you want to just hover the mouse over this icon, deciding on treatments for prostate cancer, so let's look at that one. You can just click on that, and it's loading. And it brings us up to this page. And this is just a blurb about this module. This is one of the modules. And if you scroll down, there's a video. And you would just, it's just like YouTube, you just click on the red button, and it starts about an hour-and-a-half long presentation. This one just happens to be a urologist and a radiation oncologist from Vancouver talking about radiation and surgery. So if you were in that decision-making phase where you've just learned you've got prostate cancer, you now know you need to make a treatment decision, this would be a good one to watch. If we went back to that home page, and you wanted to know about sexual function, you would click on this icon, and same thing. You open up the page up, has a blurb, and then you scroll down, and there's a video to watch. Right here. She's one of my favorite people, Christine Zarowski. She's the sexual rehabilitation nurse in Vancouver, and she's awesome. Well, it's amazing, because I know Christine Zarowski, as far as being a sexual rehabilitation nurse, she's probably leading the charge for sure in BC, if not across Canada. And Canada is at the top of its game for sexual rehabilitation. So I know she alone is an amazing resource. And here she is. You can watch, you can hang out with her in your living room. I talk about sex often in my clinic, and it's often me, you know, presenting some information, and once you start talking about it, you realize people, you know, they may have been hesitant at first, but they kick the door open and they say, yeah, this is the situation, I want to know more, so what do you know about this? And it's really nice to be able to have conversations around sexual function and intimacy.
In all the videos, you're still recording all the questions that come from the support group?
We are,
yeah.
Yes.
So one thing I was going to highlight is that if you don't have time to sit there for an hour or an hour and a half, but the topics of interest, you could go right to the questions, because I think 9 times out of 10, what I saw down there are the same questions that kind of come up
Yes.
here after a discussion. So.
Well, and you think of the wealth of information
Yeah.
that comes, I mean, this whole conversation has been questions, right? Which is awesome. I think that's why we're here, right? It's not for me to stand here and yak at you.
Yeah. So sometimes that's the best part of the whole video.
Yeah.
Somebody's got that question you've had in your mind,
That's
and it comes up and the specialist answers it right
yeah,
there.
that's a good point.
Yeah.
Thank you. Clear as mud?
Mm-hmm.
Okay. Okay. Thanks, guys. Back to you, Court.
Thank you very much, Connie.
You're so welcome.
It's 4 o'clock, right on the nose. Thank you,
Yeah.
Connie,
You're
for
welcome.
the candid, up-to-date comments. I mentioned at the beginning of this is a lot of my experience with prostate issues is old stuff now, and I just love some of your straight from the hip, straight shooting
Yeah.
answers. Thank you.
I don't sugarcoat, so thank you.